emails saying, we want to know the different wrinkle relaxers. What are the injections? What are they all about? What works? What's good for me? What's not good for me? Well, now we are delivering. We have a doctor in the house. So send us your email questions. You can come to NBC10.com, click on all that and more, and send us your feedback, and we'll get answers for you. And Sherry is here with the doctor as we're about to see a procedure live. Sherry?
Yes, we are, Tracy. We've got the doctor and more. It's a new year, and if you're looking for a new face or a new look to your face, it's tough to know if you want Botox, Restylane, or something else. So joining me is plastic surgeon Dr. Greco, and he's going to give us a live demonstration on the hot new wrinkle filler, Juvéderm, and he's going to give us the lowdown on other injectables. Welcome, Dr. Greco, and Bobby Spivak, who's our patient, who I happen to know, coincidentally, and his lovely assistant over there as well. So you nervous?
Of course.
You think it's going to hurt?
No, I think it's not.
You think it's not? Well, we'll see about that, won't we? Okay, so let's talk about them, Dr. Greco. First of all, Botox. That was the first one we all knew about. That relaxes or paralyzes the muscles up here?
Yes, Botox is a medication, Sherry, that is meant to relax the muscle that creates the wrinkle. And you use the word paralyze. What we try to do with the application of Botox is we want to relax the muscle that creates the wrinkle. We don't want to paralyze.
And there's where we see it around the crow's feet, right?
Yeah, exactly. In this particular patient right here, you can see that she was concerned about the wrinkles that radiate from the corner of her eye, and by relaxing that with Botox, you can see she has a very nice, smooth appearance to her crow's feet area after the injection with Botox. Now, Botox takes about 2 weeks before patients will actually see the best result.
And we also use it for this frown line right here when people go like that, right?
Exactly. The frown line is a very popular area for Botox. It's where the medication receives FDA approval for its use. The other areas on the face are considered what we refer to as off-label uses, but very popular uses for the medication.
Okay, now Restylane, what do we do with that? Here we have some Restylane here.
Well, there's a simple concept that I like to use when I'm talking to patients about the fillers.
Here's some Restylane.
Exactly. What we're trying to do is Botox relaxes the muscle that creates the wrinkle, whereas filler provides volume and fills things up. Now, in this particular patient, she was concerned about her tear trough, or that depression underneath her eye. And I think you can see very nicely how this patient was able to benefit from filler to help fill in that tear trough and also help with the dark circle appearance underneath the eye.
Okay, and Juvéderm is what you're going to use on Bobby?
That is correct.
And what are you going to do with her?
Well, with Bobby, what we're going to do is we're going to concentrate around the mouth, and there's two different things that are occurring around Bobby's mouth. One is depressions, which are the nasolabial folds and these little indentations here, and then there's also little fine lines. And what we're going to do is we're going to use Juvéderm, which is a hyaluronic acid product, which is great for lifting up thick folds or deeper folds. And then we're going to use Cosmoderm, which is a collagen implant, a human collagen implant, and we're going to use that in the very, very fine lines.
Well, why don't you go ahead? We have 4 or 5 full syringes here, I guess, that you're going to fill her up with, huh?
We brought the house.
And how long does this Juvéderm last?
Juvéderm lasts up to 6 months,
Really?
similar to Restylane. Both products now are being tested to see what the longevity is. Restylane is still a great product. It's the hyaluronic acid that has FDA approval for the last several years.
All right, go ahead and start.
And Juvéderm is just received FDA approval just recently.
Okay, Bobby, you want me to hold your hand?
Would you please?
Please, okay.
That would be great.
Let's see. All right, we're not going to get in too close here, so don't anyone get afraid. But listen, while the doctor does this, if you have a question for Dr. Greco, contact us now online at NBC10.com. Click on all that and more. Instant message us, NBC10 more. And you got to see this injection, so you got to get off that graphic, and we'll come back later, and we're going to see how Bobby looks, because the doctor says we're going to be able to see some instant better looks on Bobby. I don't know if she can look that much better, but I can tell you that she's not screaming. She's barely even squeezing my hand. I'm more nervous than she is.
Did you tell him about the silver bullet that she has?
She's biting on a silver bullet. Okay.
It's not hurting.
It's not hurting. Well, she put some cream. They had some cream on her to deaden the area, so that's good. All right, Tracy, we'll be back later.
Excellent. I look forward to seeing the results. Thanks. And you saw the procedure live right here. Now see the results. How well do face fillers really work? Well, decide for yourself. You'll see for yourself coming up. And you have something to say about cosmetic surgery or a question for our doctor? Contact us now online at NBC10.com. Click on all that and more, or you can instant message us at NBC10 More. Okay, so we're all very excited about checking out Bobby and seeing how she looks.
Yes, we are. Just a short time ago, plastic surgeon Timothy Greco began injecting Bobby Spivak with the very hot new filler, Juvéderm. He said we could see the results in just a few minutes. So let's take a look. You've been injecting her, right? And we're wiping away the little blood that comes out with the injections, right?
Just a wee little
Has it been hurting?
Just a pinch.
Just a pinch.
Just a
okay.
pinch.
And I can see. All right, let's see the before picture. Can we see the before picture? All right, there's the before. I can see those nasal labial folds, the marionette lines. And now can we come to the after picture? Baby, they're gone. They're gone. That's great. So that's where you injected her, right in there, right?
Yes, actually the fold that got injected was the nasolabial fold. And fillers are also great for filling out the marionettes lines, which are the lines that go down from the corner of the mouth. And also, it's great to fill in what we refer to as the pre-jowl sulcus. That's that indentation that occurs right next to the jowl. So what you can do is you can get some injection done there and you get a facelift without having the scalpel.
Wow, do you have a mirror to show her what she looks like? Lita, I don't have one either. Oh, too bad. But
left
she
my
looks
Trust us, you look great.
I left my
Thank you.
compact back at the
You
office,
did.
so
I
forgive me.
feel good.
Well, that's great. And we have some questions from you from some of our viewers, Dr. Greco.
Absolutely.
You ready? Rosie from Camden County emailed and asks, how do the doctors determine who can get these procedures done without any devastating reactions? People are concerned about that.
Yeah, I think the thing that is most important is to make sure that the product doesn't create an allergic reaction. And in order for the product to obtain FDA approval, part of the FDA approval process is that to make sure that the product doesn't need a skin test. The products that we mentioned here today and the products that were injected for Bobby don't require skin testing. So Juvéderm, Restylane, Cosmoderm do not require skin tests. However, collagen, bovine collagen, which means from cows, that still does require skin testing.
Okay, that's a good one.
And Charlotte from Chester County asks, what fillers can be used for the under eye area or the hollows under your eyes? If you can't use fillers, what do you suggest? So this part right here, right?
Yeah, that's a great question and
Yeah.
something that we get asked very frequently. It's those depressions create dark circles. And Restylane, Juvéderm are excellent products for help to lift up on the folds. We had a patient earlier that we showed the before and after on that, and it just really does help to fill in that tear trough. Now, certain patients will benefit from lower lid blepharoplasty or eyelid surgery to
If
remove.
they have bags, right?
Exactly, exactly. To remove the puffiness. The bags actually create a shadow and create the hill valley phenomenon, and basically what we're trying to do with a filler is lift up on the valley.
But isn't it dangerous to inject right under your eye?
It helps to have a steady hand, but it's a safe.
Yeah.
So that's a question to ask when you go to the doctor. You think, do you have a steady hand?
Yes, I did.
It's a safe procedure.
Yeah.
Is it? Now, what about Sculptra? That was a big one. Oh, can you tell us real quick, because we're
Yeah.
almost out of time.
Actually, Sculptra is a product that you inject into the deeper tissues of the face, and it creates a reaction that creates volume. The problem with Sculptra is that you got to wait 4 to 6 weeks before you actually see the result.
bummer.
You won't see it right away because it takes time.
like to
Great,
see that.
Bobby, you're
Great.
even more gorgeous.
Thank you.
Yes,
Thank
you look
Thank
fabulous.
you so much, and thank you, Doctor.
Dr. Greco, thank you
for
so
having
much.
us.
Today on All That and More, a new face for the new year.
Cosmetic injections could be the answer. Question is, what's right for you? Tracy Davidson and medical reporter Sherry Bank join us now with the answer. Good afternoon, ladies.
Good afternoon. This was a great show. There was a lot of interest in this today. We had a doctor in the house, and he did a live demonstration.
Plastic surgeon Timothy Greco showed us the hot wrinkle filler Juvéderm. He showed how it worked on patient Bobby Spivak right here in our studios. He says you have several options: Botox injections relax the muscles that create the wrinkles. Juvéderm is one of several injectables that provide volume to fill in your wrinkles. Juvéderm lasts up to 6 months, and it's what he used today to fix Bobby's nasal labial folds.
There's two different things that are occurring around Bobby's mouth. One is depressions, which are the nasolabial folds and these little indentations here. And then there's also little fine lines. And what we're going to do is we're going to use Juvéderm, which is a hyaluronic acid product, which is great for lifting up thick folds or deeper folds. And then we're going to use Cosmoderm, which is a collagen implant, a human collagen implant, and we're going to use that in the very, very fine lines.
Baby. Before and after
gone.
for our patient Bobby Spivak. She looks pretty darn good, don't you think?
I think she looks really good, and she promised to send us a picture in a couple of days.
When the swelling goes down and when she had blood on her face. So you know, she's going to look better in a couple days.
You can still see the big difference.
Yeah, definitely. She looks great.